Good afternoon, everyone. It's a pleasure to be here with you today to talk about type 1 diabetes and stigma. We'll talk about realities and consequences. So we hope that you will enjoy this talk. My name is Anne-Sophie Brazeau. I'm a dietitian and an assistant professor at McGill University at the School of Human Nutrition. And I'm here with my students and colleague, Asmaa Housni, who's a dietitian as well, and a PhD candidate in my group. And so she'll be presenting part of her work today with you, sharing her work with you today.
Thank you. So on the agenda today, first we'll look at what is diabetes-related stigma, some definitions, look at what are the consequences, how the stigma affects different aspects of the daily life of people with type 1 diabetes, their relatives, how is type 1 diabetes represented in the media, and we'll go over how to cope, some methods, some strategies to cope with the stigma and to reduce stigma potentially. And feel free to discuss as we present, either using the chat box or asking your question using the Q&A function on Zoom. So this is meant to be interactive as best as possible. Before we start, quick word on the Better Registry. We will be presenting some of the findings and some of the results that we obtained through an analysis of the registry. It's a registry of people with type 1 diabetes in Canada and has now more than 3,800 registered participants across the country. And if you haven't done so already, feel free to access the Type 1 Better website or scan the QR code to register and become a participant in the registry. So what is diabetes-related stigma? It's a social process that can be experienced, but can also be anticipated. It's whether this perception is lived or anticipated. It is characterized by the exclusion, the rejection, the blame, the devaluation that can result from either the experience, as I mentioned, or perception by this person living with diabetes. And diabetes or type 1 diabetes is a visible illness, and its management is visible as well and can be linked to some unfavorable social judgment that can result towards this person or this group. So in general, it can be perceived as this negative social judgment that can result from stigma. What leads to stigma? There's a lack of understanding of what diabetes is. So not understanding what are the causes, not understanding the management of diabetes, the consequences. All of this can lead to these preconceived notions or erroneous beliefs about diabetes that can stigmatize the individual living with diabetes. Self-management. We know that the person living with type 1 diabetes is in charge of their condition. And so this management is central to type 1 diabetes, and it amplifies the idea that if something is not done properly, it's the person's fault, and really puts and emphasizes the blame that can be perceived towards that person living with type 1 diabetes, when we know that different factors are involved in this condition. When we think about the role of genetics, the environment, the socioeconomic status, the psychosocial factors that are often overlooked, and we look at this behavior as individualized, and when it should be made into a complex context.
Well, maybe I can start with presenting the results of one of the first study that was done in Canada to look at stigma in type 1 diabetes. So in 2008, the International Diabetes Federation have made a call actually that we need to raise awareness about stigma, and we need to come to an end to have stigma come to an end. And so since 2010, there have been a bit more studies highlighting the reality of people living with diabetes. And so this study that I'm showing some results here was one of the first. And so in 2018, we published the result of the study on almost 400 adolescents and young adults living with type 1 diabetes in Canada. So we were interested in establishing the prevalence of people feeling stigmatized by living with type 1 diabetes. And so we use a scale. And so someone was classified as being stigmatized if they endorse one of the three statements. So there was, I try not to talk about my diabetes in front of my friends, so hiding their diabetes. I find it difficult to tell people that I live with diabetes and feeling embarrassed to perform tasks related to my diabetes in front of other people. And so when we look at the results, it was about 2/3 of the participant that expressed being stigmatized or adhering to one of those behaviors. And so this proportion was a bit lower in adolescents. It increased in young adults, so from 61 to 69%. And we also saw that it was more the girls or the women that felt stigmatized compared to boys, and there was really different ways of them feeling stigmatized. And so we have not only asked them to fill a scale, but we also had open-ended question. And so we asked people to share an example of a situation where they felt stigmatized. And so there was different situation. So being afraid of what others will think if they have hypoglycemia, if they need to monitor their blood glucose, what people will think because they have diabetes. Will they think that they are not healthy? And so some people were also afraid of doing their diabetes care because of the judgment that would come with it. So those are just three examples of testimonial that we received. And so two of them are from young adult men. One example was that so this young man told us this story that his girlfriend families thought that like it was very concerning that their daughter was dating someone living with type 1 diabetes, because that means that there was like diabetes related complication. And so they were warning the daughter that she may have to take care of him, and so it might not be a good idea to date someone living with type 1 diabetes. So that was one example. Another example that we got was this man standing in the line at a restaurant and just hearing other people giving comments on foods and linking like the sugar in foods to diabetes. And so he felt uncomfortable just hearing people saying this drink is so sweet, it's going to give me diabetes, because again, it showed how misunderstood diabetes is in the population. And another example was from a young girl of 16 years old, young girl, and she said that she felt judged when she was going to an appointment with her endocrinologist, because he would check her A1C and she was anticipating being judged, that he will think she's not good enough because of her A1C results. And so what this study showed us is that there are tons of reasons that may lead to this stigma related to the management itself, the blood glucose, the consequences of diabetes. So when you have an hypoglycemia episodes, when each time they need to make a decision regarding foods, injecting in front of other people, having to wear devices, the impact that diabetes may have on others, the example was that like they feel limited or restricted or isolated because of their diabetes, not being able to participate in some activities. And the fact that there's so much misconception about type 1 diabetes and diabetes in general, and so people don't necessarily understand that insulin is a lifesaver, and you cannot just stop taking insulin just because you don't want to inject yourself anymore. So there was many examples. So stigma can be related to anything associated with diabetes and can come from everyone or anyone. So it could be strangers just talking in the Starbucks line, but it could also be from teachers, coach, work colleagues, the employers, classmates, friends, but it can also come from people closer, the family members, the close friends, but it also comes from the healthcare professionals. And so it's not because we are trained as healthcare professionals to not have negative judgment. Sometimes the way we express ourselves doesn't, maybe the intention is not to stigmatize the person, but this is how the person feels it. And so we need as professionals to also recognize that. So anything, anyone, and everywhere. And so we receive example of stigmatization situation in public places, at school, when traveling, at work, during some social events, but also more and more through social medias. And so I think it's important to recognize that like it can be anywhere, and we need to create safe places. So this is what we did a couple of years ago on a very specific population of 14 to 24, but with the better registry, we have opportunity to look broader, and that's what Asmaa is going to present to you just now.
Yes, exactly. So sort of to follow up on this study, we looked at this topic of type 1 diabetes related stigma across different ages, and we analyzed the data from the registry. Our main objective was to measure this perception of stigma in the registry. And to do that, we included self-reported data from the registry participants that were aged 14 years and above, and who completed the third questionnaire. So this questionnaire contained questions that were specific to stigma, and that included the validated scale for assessing type 1 diabetes stigma. It's known as the type 1 diabetes stigma assessment scale, or the DSAS-1. And this scale consists of 19 statements to which participants respond using a 5-point Likert scale. So that means for each statement, participants can select a score from 1 if they strongly disagree with that statement, or and can go up to a score of 5 if they strongly agree with the statement. And the DSAS-1 is categorized into 3 subscales to identify 3 different factors in the perception of the stigma. Is it more related to feeling treated differently, or having identity concerns, so feeling like the identity, one's identity is threatened or embarrassed by what other people might think of their diabetes management in public, or is it more related to the perception of blame and judgment with regards to their diabetes? So a total of 709 participants were included in this analysis, and our research objectives were to first quantify this perception of stigma, so determine if there is a perception of stigma in the registry, and then to compare this stigma and the factors behind this perception of stigma across different age groups. And we defined predefined 4 age groups: youth that were aged 14 to 24 years old, young adults aged 25 to 34, middle-aged adults aged 35 to 64, and then seniors that are aged 65 years and above. And we also wanted to look at the associations between type 1 diabetes related stigma and mental health, and as well as self-management behaviors. for the results. So when we first looked at the statements of the DSAS-1 scale, we looked at those with the highest percentage of agreement. So the participants either agreed or strongly agreed with that statement. And we looked at these statements for each age group. And the perception or the perceived judgment when consuming sweet foods or drinks was unanimous across age groups. It was the statement with the highest percentage of agreement in the participants that we analyzed. And for youth and adults, they both shared the perception that people assumed what they can or cannot do, or they made unfair assumptions because of their type 1 diabetes. For seniors, it was more the perception that people thought it was their fault if they take insulin. And then the third statement with the highest agreement, for youth, it was the perception that others think it's their fault if they live with type 1 diabetes. For adults, it's the perception that others think it's their fault if they take insulin. And for seniors, so aged for 65 years and above, nearly 21% of them felt embarrassed about what other people might think if they needed help treating a hypo in public. So when we look at the mean score, so looking at the statements of this DSAS-1 classified by these stigma factors, so the 3 subscales of the scale of the DSAS-1, and then looking at by age groups. When we look at the different subscales, we can see that the perception of blame and judgment was the most perceived within the cohort. It was followed by identity concerns, so stigma related to identity concerns, and then feeling treated differently. And it's worth noting that the perception of feeling treated differently had mean scores below 2, which suggests that participants generally strongly disagreed with this stigma factor. And this was noticed across age groups as well as across genders. So this would suggest that it may not be perceived as an issue for this registry, for this participant. When we look at stigma categorized by age groups, it was higher in youth. So 14 to 24 years old in orange perceived more stigma compared to adults and seniors. And similarly, women in blue perceived significantly more stigma when compared to men in gray. And another observation here is that much like feeling the feeling of being treated differently, which was generally not perceived as an issue, seniors generally responded with scores below 2, which also suggests, an overall disagreement with the perception of stigma, and it was noticed for all 3 subscales. So for the perception of blame and judgment, for identity concerns, as well as feeling treated differently. So the main takeaway from this study is that the perception of stigma was higher in youth aged 14 to 24 years old, and it was higher in women or individuals identifying as a woman. And regarding the most prominent stigma factors, so what the factor contributing to this perception of stigma was the blame and judgment that came first and was followed by identity concerns. To summarize these results, they clearly identify individuals who are more vulnerable to the perception of stigma, namely youth and women, who are more affected by this type 1 diabetes related stigma, and underscores or emphasizes the need to have targeted interventions and to have strategies that in order to reduce stigma, they need to be inclusive and they need to take account different experiences and different realities to encompass all people living with type 1 diabetes. And the perception of blame and judgment was significant in the registry, which further confirms the need to have awareness campaigns to challenge stereotypes and provide support for people with type 1 diabetes. And finally, this need for targeted interventions opens the door for future research. If we want to have a better understanding of which interventions would be more suitable for different age and gender populations, we are considering, following up with a qualitative study to have either interviews or focus group discussions to just delve deeper into the topic and understand what would be strategies going further to try to reduce the stigma. We know that diabetes-related stigma can have multiple consequences on people with type 1 diabetes, as well as their close ones, their relatives. And that includes emotional and mental health, emotional well-being, mental health, self-confidence, or lack of self-confidence, isolation, discrimination. It can have an impact on diabetes management, whether it's medication adherence or glucose monitoring that can be reduced, or it can influence different aspects of finances. So there are different real consequences of this perception of this lived stigma.
And so when we did the study in adolescents and young adults, we look at what was associated with those people that have said that they were feeling stigmatized or having those behaviors. And so if the people who had stigma were the people that were also reporting more severe hypoglycemia in the past year, they were also reporting higher A1C in general. So we can see association between stigma and complication of diabetes, and uncontrolled glucose management. We don't know if it's the cause, the consequence, but there's association, and it could be bi-directional here. People with stigma were also reporting less well-being and a lower level of self-efficacy to manage their diabetes. And so again, is it one causing the other? But clearly, if we work on reducing one, we will help the other one. There was more difficulties in managing feelings and frustration about diabetes if they were stigmatized.
In the registry analysis, we also looked at these consequences. We found that there was an association between this perception of stigma and higher diabetes-related distress, participants having more depression, more reported depression, more fear of hypoglycemia, less social support. There was also more behaviors to avoid hyperglycemia. So we further found associations between this perception of stigma and psychosocial determinants, as well as management behaviors.
So we've seen clear association with stigma, how it can impact the person, but it's important that we present or represent type 1 diabetes in the appropriate ways in the medias, because that is one thing leading to the misunderstanding of what is type 1 diabetes. And so the media has a responsibility to make sure that we give a fair representation. And what we've seen often in the past is that diabetes was depicted as those are overweight, obese people, they don't do exercise, they eat too much sugar, they don't adhere to their treatment. So that's why they have complication. They are just lazy people. And this negative way of depicting diabetes may have a big impact. And so there have been examples for type 1 diabetes of misrepresentation in the medias, different movies and series that just provided wrong information, giving water to prevent hypoglycemia, using very big needles to inject insulin, like scaring people about what is insulin injection. There have been some for the Anna Montana, that's been 15 years from now, but like there was a parent very frustrated about how they showed what is type 1 diabetes in this episode, and so the episode was removed and they had to replay, and they did a new version of the episode because there was a misrepresentation of type 1 diabetes in it. So those are just examples. So that it's either that they don't present it well, or they just present wrong information, that someone with diabetes cannot eat any sugar, or they will show that this person needs to be like put aside, isolated. And for the children, which are often underrepresented in those series or movies, there's a bit of sometimes like what we'll see is that they need to hide the diagnosis from their friends. They should be ashamed of their diabetes, and so like all of those misrepresentation may have an impact on people. So but I don't want to say that everything is bad, and we also have good examples, more recent good examples of ways of talking about diabetes in different movies and series. And I think it's important that we have this showing that we are maybe going in the right direction of trying to reduce this type 1 diabetes related stigma. So how can we deal with stigma? It's not easy. The person, that this is something that they may, like as we mentioned, you may get a direct comment on your diabetes. It could just be because you're seeing those ads or this misrepresentation, and you feel uncomfortable with the way people talk about diabetes. So so as a person living with diabetes, the person would need to develop his or her own resilience, so their ability to confront the challenges, to bounce back, and like to rebuild positively their experience with the situation. It takes time. It's not easy each time. We need to focus on our strength, but we need also to make sure that we have a social support network, that we have the resources to take care of our condition. We need to make sure that and so this is not only the sole person with diabetes that can help reduce the stigma, but this also comes from the environment and the policies that we put in place and so on. So internally, we can build our strength, but we need to make sure that we have access to the right therapies, the right treatment, that we have access to healthcare, to education, and that the policies and the environmental decision, the decision that we make around the environment needs to be also helping the person.
How to reduce stigma. So yes, finding ways to cope with the stigma is important, and more importantly, it's crucial to participate in reducing the stigma by shifting the narrative from blame, from individual responsibility for diabetes, from the pressure to conform to social norm, to control, and evolve this narrative towards a more nuanced, more compassionate, a more inclusive approach that integrates the various factors that we know influence are involved in diabetes, such as genetic or behavioral factors, biological factors, social cultural constructs, environmental factors, which are all part of this definition. And this approach is essential to deconstruct stereotypes, to promote a better understanding of type 1 diabetes, to encourage a respectful and an inclusive environment.
And I would say everywhere. And so those are examples of how to reduce stigma that was provided by youth. And they're suggestion was to give more education about what is diabetes in school, in workplaces. It's a better representation of diabetes in television series and movies. And it's also having not only type 1 diabetes being like the problem in the series, but just having random people living with diabetes being pictured in because that's just daily life. Increase advertising in the media. So there's different things that can be done. There's different things that could be done also at a more political level. Proposing clean spaces in public places so we can test and inject insulin as needed, having more healthy food choices with nutritional information that can just facilitate the food choices, and that would be a way to help with diabetes self-management and just promoting a healthy lifestyle in general. So again, acknowledging that our behaviors is not all it's not only because it's not just someone's willingness to do it, there's so many more factors associated with it. So there's different effort underway. There's been there's a movement right now called End Diabetes Stigma and Discrimination, and you can sign to be part of this movement. So the idea is to put an end to diabetes-related stigma, and you can have more information if you go to the website. But we also see on social media some influencers showing positive images of what is living with type 1 diabetes, this demystifying like the myths and misconception, and just raising awareness about, yes, it's a challenging condition, but people live healthily with diabetes, and there's a future for people with type 1 diabetes. There's online awareness campaigns to reduce stigma. There's also peer groups. So social support is quite important to help build help to support the person living with diabetes, help with coping with some situation, building the resilience that we were talking before. And so there's different groups, peer support groups that you can join to find the support you may need. And the Better team is also trying to help raise awareness about stigma and also reduce the stigma. How do we do this? I think you've seen that maybe on the social media. We try to have active communication with our articles or different posts and reels, our webinars, because we want to make sure that people as a comprehensive understanding of what is type 1 diabetes, what it's everything related to the management, the consequences, and the impact it has on people affected by this condition. The registry providing a lot of information, and that's why we want to share those results. So we conduct studies, and we have students involved, and we do presentation. So if you're not already part of the registry and you want to share your experience, please do so, because it's important that we give the most accurate portrait of what is living with type 1 diabetes in Canada. And we have also developed some self-guided training platforms to help train people living with diabetes on diabetes self-management, but not only them, but also healthcare providers. And so we have those platforms to help with the new technologies and therapies and making sure that everyone has access to education. You can sign up if you want to hear more about our online platform. We hope that we are helping in reducing stigma. More research is needed, but we need to continue to raise awareness about this issue. From what we've seen in this initial study in 2018 and from now, it's still very prevalent. Like there's a lot of people that feels stigmatized. Young adults is a population very vulnerable to this, and we need to make sure as a society that we recognize that. So if you want to join us, if you want to share some of your experience, we'll be happy to discuss with you. You can use the discussion forum. You can use the Q&A. And if you have not participated in the registry yet, we invite you to do it. What is missing in terms of stigma is more longitudinal data. So we've seen changes in policies in recent years, more reimbursement of continuous glucose monitoring, the fact that someone doesn't need to prick themselves, like more people are not pricking themselves to check their blood glucose. Do we know if this is going to help on the stigma experienced by people? We don't know, but if we can look at data over time, it will help us to show and explain how this is evolving in the right or wrong way. Actually, we don't know, and this is something that is missing in studies all around the world. And we hope that with the better registry and the fact that there's annual questionnaires, so you can show, and we can show that it's either stable, it increased, it decreased, that the realities is fluctuating, that our effort are not giving good results, or on the other side, yes, there's some things that are working. And so we want to better understand this reality. And so it's important that if if this is something that is meaningful for you, that you don't hesitate to share with us your experience. And I just want to thank 3 patient partners and colleagues. So Alexandra is another student in the lab that have done all the work on the media portrayal, looking at all those movies and series to bring all those examples. And Michael and Lawrence are 2 patient partners that have been very insightful in designing those studies and interpreting the result. Why is it doing this? I don't know. It's been reviewed. Sorry about that. So Laurence and Michael have been very helpful to help us researcher in designing those studies and interpreting the findings. So those are the studies that we presented today, are example of patient-oriented studies. So we have worked with the patient to develop the questions, the questionnaires, and then to interpret the findings and to see how relevant this is to their lived experience with diabetes. When we gave the webinar in just before in French, there was a lot of comments about what do we do for example, children in school. Is there ways of making sure that they feel less isolated, or they don't feel any blame for having type 1 diabetes? And so we were talking about the importance of education. If this is something that you don't necessarily know how to educate the people about what is diabetes, we have some videos from the Better project that you can use. If this can be, if you're looking for videos, we have videos about how to use nasal glucagon, for example. So it's important that people understand what to do if there's any serious complication of diabetes occurring. And so there's different things that can be used to just explain what is diabetes without scaring anyone, but just making sure that everyone has the opportunity to express themselves, ask questions. And so as parents of children, you can be the one for sure providing some education. There's different association of parents that you can of patients that can also help to advocate and help making sure that like you have the resources in school or at work. And so you can also look at their website and reach out to them if you need any help.
I can
Asmaa,
yeah. I can maybe add that, and also based on what we found, it's really just to reemphasize it was the lack of education from people in your surrounding. And one of the concerns that was shared by participants was it's what is diabetes, you live with it, but sometimes explaining it to others can be challenging. And so just having resources that are readily available that you can share, or on social media. So we have those as well. And in our in developing a platform to try to just make these resources available and simplify sharing of information, that can be one of the ways to try to change this narrative and try to break stereotypes. So that's also something that we have been working on.
And following the stigma study in youth, we help creating a peer support network for youth with type 1 diabetes for those living, those aged 14 to 24, is called VPN Type 1, Virtual Patient Network Type 1. It's a private Facebook group for those youth, and it's bilingual. So there's a lot of discussion going on. It's moderated by certified diabetes educator who look at what's being published, make sure that it's safe suggestion or that are being given. So that may also be another resource to help youth with type 1 diabetes. I don't see any. So the chat is not working. So if you have anything to say, you can just write it in the Q&A section, and I can share your commented experience with everyone else. I did ask for the chat to be open just because I feel that a topic like stigma, sometimes the real experience is very powerful to just make others realize that they are not alone. When I read through all the open-ended answers of the reason why people feel stigmatized or the different situation, it was eye-opening for me as a researcher, but also someone who wants to help people living with type 1 diabetes. And this is why I want to do more to help reduce stigma. There was a question. Do you incorporate an epigenetic approach in your research to look at the environmental condition in which the patient you work with have been diagnosed? That's interesting. We don't necessarily ask about information at the diagnosis. In the Better Registry, we are really looking at the current situation and that much at what happened around diagnosis. But this is definitely an interesting point, and we should look into that. We also got another comment saying it's disappointing that things haven't changed much since I was diagnosed 50 years ago. I think maybe stigma is still there, and I think it will still be, even though we do a lot of different effort to try to remove it, because there are so many different aspects of what stigma is. I think there's been some effort done, maybe not always the right one, and so we need to try and do it again and try something else. But I hope that there are changes. There's another comment about we stratify the result by gender identity. I was wondering if there was a big difference in the number of responses between gender identities. So do you remember if you had more women than men?
I think it was roughly similar in terms of the responses, but the perception of stigma was significantly more perceived by women compared to men.
So in the youth study, we had a bigger proportion of girl answering the online survey than boys. However, when we look at the results again, like Asmaa was saying, like they reported more feeling more stigmatized than boys. And so is this because the way they internalize and cope with their diabetes that they don't feel it as much? Hard to tell it, but very interesting to see those gender differences, because that also talks about how maybe targeted intervention or that we need to develop. We will end here for today. Thank you very much to have spent the last 45 minutes with us, and I wish you a good end of the day. Thank you very much.
Thank you.